Hello, my name is Kevin Greason, and I'm an Associate Professor of Surgery in the Department of Cardiac Surgery at Mayo Clinic, Rochester, Minnesota. Today I'll be speaking with you about transcatheter aortic valve insertion in the treatment of symptomatic severe aortic valve stenosis. The aortic valve is a valve that sits at the top of the heart. All the blood comes out of the heart through that valve. Normally that valve is about the size of a quarter. In patients that have symptomatic severe aortic valve stenosis, that valve has narrowed down to about the size of a number 2 pencil. And we know that once you start having symptoms related to severe aortic valve stenosis, the chances of dying or having a major cardiac event over the next year are quite high, probably 50%. The main symptom that we see with symptomatic severe aortic valve stenosis is shortness of breath with activity. In the past, the only treatment for aortic valve stenosis was aortic valve replacement through open heart surgery. We would divide the breastbone, put the patient on the heart-lung machine, cut out the bad valve, and put in the new valve. Since 2008, we've been using a new technique called transcatheter aortic valve insertion or replacement. This is also known as TAVI or TAVR. In this technique, we can puncture the artery in the groin and insert a new valve, much like a cardiac stent. In over 90% of patients, we can go through the femoral artery. In 10% of patients, we will access through a cut underneath the left breast, through the top of the breastbone in the aorta, or the artery to the left arm. The transcatheter aortic valve insertion is proven to be a safe procedure. In comparison to surgical aortic valve replacement, we know that the chances of bleeding are less with transcatheter aortic valve insertion. Renal failure requiring dialysis is also less after transcatheter aortic valve insertion. And there are no differences in the prevalences of myocardial infarction, stroke, or need for pacemaker. The transcatheter aortic valve is a circle. The normal aortic valve annulus is an oval. When you put a circle inside of an oval and try to make the oval a circle, sometimes two don't always meet and you can have leakage. However, in only about 5% of patients is this a problem. There's also a higher incidence of vascular injury with transcatheter valve insertion, as we are putting a rather large tube in the femoral artery. As transcatheter aortic valve design has improved, the delivery devices have become smaller and the risk of vascular injury subsequently has reduced. Currently, there's a less than 5% chance of major vascular injury with transcatheter valve insertion, and we expect that number will continue to get smaller as new design devices are entered into the clinical arena and are smaller in diameter. Several randomized prospective studies have been done comparing transcatheter aortic valve insertion to surgical aortic valve replacement. We know that patients who are of intermediate or high risk, there is no difference in the prevalence of stroke or mortality after transcatheter aortic valve insertion and compared to surgical aortic valve replacement. At Mayo Clinic, Rochester, we've completed over 1,000 transcatheter aortic valve insertions, and our current major stroke rate is less than 2%, as is our mortality. Transcatheter aortic valve insertion is currently being evaluated in patients who are low risk for cardiac surgery. This is a nationwide study, and we are a site that is actively enrolling. It is anticipated this study will go on for the next 10 years. Contraindications to transcatheter aortic valve insertion include active aortic valve infection, bicuspid or a two-part aortic valve, and isolated severe aortic valve regurgitation. In our experience, over 99% of patients who undergo transcatheter aortic valve insertion have symptomatic severe aortic valve stenosis. The federal government has approved transcatheter aortic valve insertion for intermediate and high-risk patients. This has been approved by the FDA and CMS, and therefore Medicare will cover it. Thank you for listening.